teletypically. I'd ask the MIS, is there slides that they were going to present, or are we going to see that later, Senator Torres, after the live testimony first?
No, sir.
Okay. So we'll begin then with Mr. Dave Lebowski. You'd be first, followed by Ms. Lynette. You'll be next, and then Carla would follow. Okay, and then we'll have the slides and any written testimony that Senator Torres has received, because I know we do have a handful, and if they can be read for the record, I appreciate it. Dave?
Good morning, Senators. My name is David Lubovsky. Thank you for allowing me to give testimony on Bill 1336. I am sorry, but I am not in support of this bill for many reasons. As you may know, due to a family tragedy, I have become involved in advocating for changes in medical care on Guam for patient rights that will have a positive impact and protect medical health care consumers. I have not only had firsthand experience of the tragedy of medical care gone amiss, but I have spoken to dozens of consumers, nurses, doctors, and others about consumer-related care and issues over the last 2 years, including and especially at GMH. In my opinion, if this bill becomes law, it will put the poorest people on Guam in more jeopardy for increased poor medical care than they already now receive at GMH, due to the departure of nurses for better salaries. Nurse retention due to salaries is already an issue, per GMH Administrator Ms. Lillian Posadas in her testimony during the 35th legislature on the same bill. I raised the question, do we need this bill if we just pay our Guam nurses what they deserve at GMH, which should be around $75,000 per year. $75,000 per year is the national average. Won't that attract off-island nurses and pay nurses on Guam a deserved salary that they have been deprived of for decades? This bill will make it easy for our nurses to leave or be recruited for the big salary in other compact states. With Guam's average nurse salary at the lowest of the 34 compact states, our nurses should be earning at GMH around $75,000 per year, and that will put them only in the middle of what nurses earn in the compact states. Do the people of Guam not deserve the same standard of nursing care reflected by salary as the rest of the country? Does anyone here really think that nurses under the compact from other states will say, oh my gosh, let's go to Guam, it's so beautiful, and then get here and be poor? As that is what our nurses' salaries look like. Or will our Guam nurses with this compact, especially GMH nurses, say, you know what, let's move to the States, not have to work 2 jobs, have more time together as a family with better working conditions? Our GMH nurses have perhaps one of the lowest salaries in the nation and work under extremely difficult and at times hostile conditions, including being bullied on the job, especially H1 nurses. Working conditions for nurses need to improve at GMH with an increase in pay to attract nurses, or they, as Ms. Posadas alluded to, will leave. Bill 13 will increase our dependency if nurses do leave on H1 nurses. There's nothing wrong with H1 nurses. They're great, except for one thing. They fear losing their jobs and being sent back home and not being able to support their families. That fear, if they're the ones who replace our nurses, raises serious questions about their ability to step up and assert themselves with doctors and others in a medical life or death crisis. I have witnessed this. I have lived this. I saw this firsthand at the hospital. Bill 13 is for bringing nurses easily to Guam to meet emergencies, or like the pandemic. While we are waiting for the next emergency, our underpaid nurses will be heading for better jobs. Personally, I think that is the bigger emergency and concern, losing nurses that we have now. Our public hospital will get the short end of the stick. And again, the poorest on Guam will continue to be put at risk with less nurses who are overworked, impacting medical care, patient care negatively for the most vulnerable on Guam at GMH, where care already is a challenge. As I witnessed and was documented by the feds under the Medicare Services CMS report for 12 patients. If you have not read that report, I suggest that you do. Also, from what I understand, the Guam Board of Nurse Examiners will lose control of who comes to Guam under the compact. This is a big concern with no local vetting. Why would you rely on others to protect our loved ones on Guam? Even the doctors have a compact, but they still screen incoming doctors who want to transfer to Guam. I think Bill 13 is backwards. The legislature should concentrate first on getting Guam nurses' pay raised to a rate closer to the national average, which is $75,000, to attract more good nurses from off-island, and to pay our nurses their worth, rather than keeping our nurses poor by national standards. Guam needs to attract good nurses. That's a given. And the best way to do this is by paying our valued nurses more and improving working conditions at GMH. To be honest with you, and with due respect, it's almost embarrassing or even laughable to look at the compact list of states and see that Guam will be at the bottom for nurses' salaries. This says volumes as to how we value health care in Guam, beyond talk and special interest legislation compared to other compact states. That should tell you something. Thank you, Senators.
Thank you, sir. Ms. Lynette, your last name is Fires, right?
Yes, it is.
Okay, I just want to make sure. Thank you.
Okay. Good morning. Thank you for allowing this public hearing to further discuss this very important topic that allows adequate nursing care to the people of this island. My name is Lynette Fires. I am a registered nurse. I work at GRMC in the ICU for approximately the last 4 years. I began my nursing career 23 years ago as